Before you or someone you love checks into a hospital, I need you to watch this first. Every single day, seniors across this country walk into hospitals trusting that the system will take care of them. And in most cases, the doctors and nurses genuinely want to. But the system around those doctors, the paperwork, the billing codes, the discharge processes, is quietly making mistakes that are costing seniors their money, their recovery, and sometimes their lives. My name is Dr. Alex Gravis. I've spent years working with patients over 60, and I made this video because what I keep seeing in my practice is not acceptable. These 5 mistakes are not rare. They happen every day. And the people they happen to are not careless people. They are people who simply were never told. By the end of this video, you will know exactly what to watch for and the exact words to say to protect yourself. Mistake number 5, the observation status trap. Let's start with number 5. And I want you to pay very close attention here because this one blindsides more families than almost anything else I see. When you are brought into a hospital, lying in a bed, being monitored, receiving meals, seeing specialists, you naturally assume you are admitted as a patient. But there is a classification called observation status, and it means the hospital considers you an outpatient, even while you are in that bed. Why does this matter so much? Because Medicare Part A, the coverage that pays for skilled nursing and rehabilitation after a hospital stay, only applies after a formal inpatient admission of at least 3 consecutive days. Observation status does not count, not 1 hour of it. I've seen patients spend 4 nights in a hospital, get discharged, go to a rehabilitation facility, and receive a bill for over $20,000. Because on paper, Medicare never saw them as admitted. Here is what you do the moment you or a family member is placed in a hospital bed. Ask this question directly to your doctor or the case manager. Am I admitted as an inpatient or am I under observation status? If the answer is observation status, say this: I am requesting my status be reviewed for formal inpatient admission based on medical necessity. That request gets documented. In many cases, when a patient asks, the status is reviewed and changed. The hospital is also legally required to hand you a written notice called the Moon Notice, the Medicare Outpatient Observation Notice, within 36 hours of your arrival. If you have not received it, ask by name, have I received my Moon Notice? Those 5 words tell the hospital you know your rights. Mistake number 4, the surprise out-of-network doctor bill. You did everything right. You called your insurance company, you confirmed the hospital is in network, you feel prepared. Then 3 weeks later, an envelope arrives, a bill for over $1,000 from a doctor you have never heard of. Here is what happened. The hospital was in network, but the anesthesiologist who walked into your procedure, or the radiologist who read your scan, or the specialist who was called in to consult, that individual doctor was contracted separately. They were out of network, and nobody told you that at intake. This is called an out-of-network specialist surprise, and it has been happening to seniors on Medicare and commercial insurance for years. There's a federal law called the No Surprises Act passed specifically to protect you from this, and it gives you a right that almost no one uses because almost no one knows to ask. The moment you arrive at any hospital, before any procedure, say this to the billing desk or intake staff: I only consent to treatment by in-network providers under the No Surprises Act. Write that sentence in your phone right now. That one statement puts the hospital on legal notice. If they bring in an out-of-network specialist after you have said that, the financial responsibility shifts to them, not you. Mistake number 3, early discharge before you are ready. Hospitals are under enormous financial pressure from insurance companies to move patients out of beds quickly. What that looks like on the ground is a discharge that happens before a senior is actually ready. A doctor comes in and says, "You're doing well enough to go home." And because it's a doctor saying it, most people nod and start getting dressed. 3 days later, they fall getting out of the shower, or their wound isn't healing, or they are back in the emergency room, which costs 5 times more than those extra recovery days would have. Here is what you must know. Medicare patients have a legal right to appeal a discharge they believe is premature. Most seniors have never been told this. If you do not feel ready to leave, or your family does not feel you are ready, you can request what is called an expedited appeal through your local Quality Improvement Organization, or QIO. You can find yours at medicare.gov. Once you file that appeal, the hospital cannot legally discharge you while the review is being processed. The words you say to your care team are simple: I do not feel medically ready for discharge, and I am requesting an expedited appeal through the QIO. Say it. It gets documented. It buys you protected time, and it may be the most important sentence you ever say inside a hospital. Mistake number 2, medication substitution without your knowledge. And as a doctor, this one concerns me deeply. Every hospital has an internal pharmacy that runs on a formulary. an approved list of medications they keep in stock. The medications that have been carefully calibrated for you over months or years, your blood pressure medication, your heart medication, your thyroid medication, may not be on that list. So the hospital substitutes a different brand, a different generic, a different version. And they often do it without clearly telling the patient, and sometimes without telling the admitting doctor clearly enough. For patients over 60, this is not a minor inconvenience. The cardiovascular system is particularly sensitive to these changes. I've seen sudden substitutions trigger blood pressure swings, dizziness, and irregular heart rhythm in patients who were stable for years on their original prescription. Before any planned hospital visit, do this. Prepare a written list of every medication you take, the exact brand name, the exact dosage, the exact timing. Carry it with you always. And when you are admitted, hand that list directly to your doctor and say, "Do not substitute or alter any of my maintenance medications without an explicit clinical review and my written consent." That sentence puts the responsibility where it belongs, on the clinical team to flag any substitution to you before it happens, not after. Mistake number 1, signing away your financial protection. And now, mistake number 1, the one that financially blindsides more seniors than anything else on this list. And most people sign away their protection for it in the first 10 minutes of being in the building, when they are scared, in pain, and handed a clipboard. When you arrive at a hospital for an admission, you are handed a stack of forms: consent forms, privacy forms, insurance authorization. And buried somewhere in that stack, sometimes folded into a longer document, is a clause that says you assume all financial responsibility for services not covered by insurance. Most people sign it without reading it. They are worried. Someone is waiting for them to hand the clipboard back. So they sign. What that signature can do is give the hospital the legal right to bill you directly at full inflated rates for anything Medicare does not cover, bypassing the negotiated rates your insurance company would have obtained. This is called balance billing, and it can mean thousands of dollars in charges that should never have come to you. Here's what you do instead. Before you sign any financial form, write this exact phrase directly beside your signature, in pen, in front of the intake person, signing only for authorized insurance benefits, not personal financial liability for uncovered balance billing. It is legal, it documents your intent, and it protects you from having that signature used against you later. If you have a family member or spouse with an upcoming procedure, take a photo of that sentence right now and send it to them. It may save them thousands of dollars. Now, before this information fades, take out your phone and write down these 5 sentences. These are your hospital protection phrases. 1. Am I admitted as an inpatient or under observation status? 2. I am requesting my status be reviewed for inpatient admission based on medical necessity. 3. I only consent to treatment by in-network providers under the No Surprises Act. 4. Do not substitute my maintenance medications without clinical review and my written consent. 5. Signing only for authorized insurance benefits, not personal financial liability for balance billing. 5 sentences. That is your hospital protection plan. Keep it somewhere you can reach it fast. I want to hear from you in the comments. Have you or a family member ever been caught by one of these mistakes? Tell me which one. Your answer may be exactly what another senior watching this video needs to hear right now. If this helped you, share it with someone you care about who is over 60. They need this information before they need a hospital, not after. Hit subscribe, because my next video covers what happens after the hospital, the rehabilitation and skilled nursing traps that are waiting on the other side. Everything we talked about today only protects half the journey. I'm Dr. Alex Gravis. Take care of yourself, and I'll see you in the next one.